the knee, bend the knee, so we take gastroc out of the equation. I then get you to plantar flex for me, gentlemen. And I'm getting soleus primarily to contract in that position. Okay? What's next?
Tibialis anterior.
Okay. And flip over. So tibialis anterior. It's a dorsiflexor coming from the front of the lower limb. If I get you to dorsiflex for me, we can see this muscle contract up here. Okay. Extensor Hallucis Longus is obviously the clues in the name. Extends the big toe. You can see this pop up just along here. And you also have Extensor digitorum. So relax the big toe for me. Just the smaller toes. That's it. And we can see that pop up here. Okay. Have you seen that?
Peroneus Longus and brevis.
Okay, the peroneals are everters, so they're going to be on the lateral side. Peroneus longus comes from the top of the fibula, basically talking the upper 2/3 roughly. Attaches in underneath the base of the first metatarsal. If I get you, relax Jim, relax. If I get you to push out, okay, and relax, again, we can feel that muscle contract again. Okay, Peroneus brevis does the same thing, it just attaches lower in, evert again, and that's it. Okay, we should probably do the muscles on the inside as well. So you have your Tom, Dick and Harry muscles, that's your tibialis posterior, flexor hallucis longus and flexor digitorum. A bit more of a subtle palpation with these. Tibialis posterior is the one closest to the medial malleolus. Then you have flexor digitorum and then flexor hallucis. Okay. The way to isolate tib post is to get the person to invert. So invert, relax, do it a few times, you'll feel a tendon pop into your hand and relax. And again, good. I want you then to curl in your toes for me. So this is then flexor digitorum a few times for me, Jimmy. Again, okay. And lastly, flexor hallucis, in, out. Okay, very good.
Tibial nerve.
Tibial nerve, okay, so flip onto your stomach for me. Actually, we might just run through the nerve pathways. Just stand up for me. You just stand up for us, Jim. Okay, and just spin around. That's it, that's fine. Okay. So, nerve that runs down the front is called the femoral nerve. Okay? That will split medially into saphenous nerve. On the outside you have the lateral cutaneous nerve. On the inside you have the obturator nerve. Okay? The obturator nerve will serve all the adductors, okay, so the groin muscles. You just spin around for me. At the back you have a major nerve called the sciatic nerve that runs down. Okay? It will split into the common peroneal, which will run laterally, and to the tibial, which will run down medially. Okay, just flip onto, just turn around. That's fine. The common peroneal will come and it will wrap underneath the fibular head. It then splits into a deep and a superficial branch. Okay, the deep branch you can feel in between the first and second toe. Superficial branch you can feel just anterior to the lateral malleolus. The tibial nerve will split then. If you can just lift up your foot for me. Just lift up one foot, Jim. It will split into a medial and a lateral plantar nerve. Okay, so if you just flip onto your stomach for me, that's all the nerves. The tibial nerve, like we said, splits medially. So if you come down from the knee crease, you won't really feel the nerve as such, but you will feel tenderness. Okay, how does that feel, John?
Yeah.
Okay, that's into your tibial nerve. You can also feel it if you flip over for me, in behind the medial malleolus. And down. Okay, what's next?
Peroneal nerve.
Peroneal nerve. Yeah. Just sit on the edge for me. We'll do the common peroneal. So, find your fibular head. It wraps in behind it. So if you dig in deep behind the fibular head, and it's quite uncomfortable generally for people. That's the common peroneal. It comes around, it splits into the deep. The deep runs down in between the first and second toes. Again, will feel a little bit uncomfortable for the person. The superficial runs down anteriorly to the lateral malleolus. Okay.
Dorsalis pedis, pulse.
Okay, so just sit back for me. And we're going to do the pulses now. Dorsalis pedis, if you come a little lateral to the extensor Hallucis Longus tendon, so we're going to get you to lift up your big toe, follow it up, relax, just in front of the joint line. You'll be able to feel the pulsing, you'll feel that on Jimmy. Tibial pulse is obviously behind the medial malleolus. Okay, I flip over. Popliteal pulse can be a little bit harder to find. If you find it's generally just central and inferior to the posterior knee crease line. And that's it. Okay. We have a few other things to do, okay? If you lie onto your back for me. For a neuro exam, we'll do a neuro exam if somebody's ever complaining of radiating symptoms, so pain down their legs, pain down their arms, any pins and needles or numbness anywhere. We also ask safety questions if anybody has back pain or any radiating symptoms. They are any fecal incontinence, any urinary retention, or any saddle anesthesia, any pins and needles in around the groin area. Okay. They're just safety questions, red flag questions for us. Neurological exam consists of myotomes and reflexes, which test the motor component of the nerve, and also dermatomes, which will test the sensory component. For your exam, we're not going to test you on reflexes, but we are going to ask you to do myotomes and dermatomes. So I'm just going to quickly run through the myotomes. If you lift up your knee, keep your knee up, don't let me push it down, keep it up, that's good, that's L2. Don't let me push your leg down, keep your leg up, keep it up, up, up. Good, that's L3. When I get you to lift your foot up, don't let me push it down, keep it up, don't let me push it down. What we're looking for here is weakness, okay, not any pain. We will note pain, but what we're looking for is weakness. Lift up the big toe, don't let me push it down, keep it up, that is L5. Okay, next is eversion of the foot. That's going to be S1. Don't let me push your foot in. Keep your foot straight, steady. That's it. Don't let me push it in. Good. And S2 is the last one. Bring your heel towards your bum, hard as you can. Push, 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 push. That's it. Okay. Have you got a little bit of tissue? Okay, I should mention as well that you always obviously compare left versus right, okay, and that goes the same for dermatomes. I'm just going to quickly show how you do a general dermatome exam. For your exam, you need to be able to test individual dermatomes, okay, so we'll ask you, show us the L1 dermatome, L2 dermatome, L3, whatever the case may be, okay. Again, we're testing the sensory component of the nerve. Jim, does that feel the same as that? Yep.
You're not doing the other way.
Yep. Feel the same? Yep. Yep. Okay, and flip over. Yep. Yep. The reason we do it across the way is you hit more dermatomes and you're less likely to miss anything. Yep. Okay, and just flip over again. So in the exam we might ask you to show us the L2 dermatome, so you'll have to come up and do that, okay? So you'll have to know all the different individual dermatomes. So that's not this part, is it?
No, that's it.
Is that? Okay, that's it. So the other thing, sorry, guy, bony points are the big one. I haven't gone through the bony points in the skeleton. They will come up in the exam as well, okay? But that's the palpation point. Alright, that's it.